Welcome everyone to Lamsa's Wednesday webinar. My name is Céline Chaaya, and today our topic is on generalized anxiety disorder. So let me present myself. I'm Céline Chaaya, a fourth-year medical student at USG, and I'm a Lamsa ambassador. Today we're going to talk about generalized anxiety disorder. So it's normal for us to feel anxious from time to time, especially if our life is stressful, especially in this environment we live in. But when anxiety takes on our daily activities and it becomes an obsession, it might be a sign of generalized anxiety disorder. So we're going to talk first about understanding GAD, so generalized anxiety disorder, the symptoms, the causes, the treatment information, some tips to manage anxiety and stress, and finally we're going to end with some myths and misconceptions. So what is generalized anxiety disorder? First, with some few numbers, GAD affects 6.8 million adults every year, and the prevalence is around 3% in the world. Women are twice as likely to be affected as men, and the risk is high between childhood and middle age, although the risk accumulates during life, and it might appear at any time during the life cycle. The causes of GAD are unknown, but some biological factors, family background, and life experiences, particularly stressful ones, play an important role. So, generalized anxiety disorder is characterized by a persistent and excessive worry about several things: money, health, family, work. So the person becomes obsessed about the topics relating his daily life, and it is difficult for them to worry and to control their worry because it becomes a central point. And worry is often unrealistic and out of proportion for the situation, and they are aware of that, so they know that they worry too much, but they can't stop worrying because if they stop worrying, they think something bad might happen. So, how do we diagnose it? So it's characterized by a difficulty to control worry on more days than not for at least 6 months, and it's associated with 3 or more symptoms. So this is the diagnosis, and we must differentiate it from worry, which is a simple anxiety concerning a certain topic or something that happens for a period less than 6 months. So people with generalized anxiety disorder don't know how to stop the worry cycle and feel it is beyond their control, even though they usually, as we said, realize that anxiety is out of proportion for the situation. So many people believe worry prevents bad things from happening, so they view it is risky for them to stop worrying. When the symptoms are mild and not very important, people may carry their normal life, they can apply to jobs, they can go out with friends, but when the symptoms are severe, and the anxiety level rises above a certain limit, it may have an impact on their daily life. So they might, for example, not show up for an interview, they might skip a social gathering, so it affects them, and this is why it is something very important to first diagnose and then treat, because it might be very helpful for them. Okay, so now we know that several scales are available to establish diagnosis and assess severity. This is the GAD-7. So it has been validated as a diagnostic tool and a severity assessment scale with a score of 10 or more having a good diagnosis sensitivity and specificity. So greater scores correlate with more functional impairment, and this scale was developed and validated based on the DSM-4, but as we know, we are now focusing on the DSM-5, and there has been some adaptation to the scale. So some of the criteria are feeling nervous, anxious, or on edge, not being able to stop to control worry, worrying too much about different things, trouble, having some trouble relaxing, being so restless that it is hard to stand still, becoming easily annoyed or irritable, and feeling afraid as if something awful might happen. So as you see, the criteria are related to anxiety and not being able to control the worry. And now, what are the symptoms? So the symptoms are the list of symptoms is very broad, and it might contain a lot of symptoms you may feel from time to time, but it's a whole. So as we said, we have we have to have at least three symptoms. So I'm going to start with the list: feeling nervous, irritable, or on edge, having a sense of impending danger, panic, or doom, having an increased heart rate, so it's tachycardia, breathing rapidly, hyperventilating, sweating, and trembling. This is part of a panic disorder that we're going to discuss in the next slide. Feeling weak or tired, having some difficulty concentrating, having trouble sleeping, experiences gastrointestinal problems. So as you see, the list is very broad, and it's not only related to the psychology field. It can also affect you uh, on your health. And as you see here, you can have some problem in your gastrointestinal tract, and you can develop stress ulcers and something like that. So what are the causes? As I said before, the causes are unknown, but many researchers had some hypotheses on the subject regarding first genetics. So it is known that when you have someone in your family who has GAD, you are more prone to having it. So the genes haven't been identified, but we know there is a genetic pathway because there are families who develop GAD, and it can be related to this. Brain chemistry, now this is a tricky part, and there hasn't been many researches on the subject, but what we should know is that there are some regions in your brain that are related to emotions, anxiety, and controlling stress and everything. And they are related to other parts in your brain with neurons and neurotransmitters. So any problem in any of these pathways might lead to the development of GAD and trouble in assessing emotions and everything. And finally, environmental factors. So someone who has negative or a trauma in his childhood might develop GAD, but not only, it can affect any stressful event might affect a person. And it's important also to note that addictive substances, so the fact that we stop taking cigarettes or alcohol or any addictive substance might lead to general anxiety disorder also. So what are the treatment options? As we saw last week on the OCD webinar, we know that it's not always just about medication. So we may start with cognitive behavioral treatment with a physician and an expert, and it might help us. And it's important also to know that mindfulness-based approach and acceptance commitment therapy have also been investigated with positive outcomes. But if it doesn't work out, we may take some medications, and there are several medication choices, like SSRIs, either alone or in combination with therapy. And finally, we can use relaxation techniques, meditation, yoga, and exercise to help us control our stress and our emotions. So there are a lot of differential diagnoses to the GAD because it's a common disorder, and it can be related to many topics, but Today we're going to focus on panic disorder because it is sometimes related to GAD and it is very frequent in our society. So what is it? It is characterized by recurring unexpected panic attacks that occur without the presence of an actual danger. So the DSM-5 defines it as a sudden onset of intense fear and at least 4 symptoms. And here are they: chest pain or discomfort, chills or hot flashes, excessive sweating, feeling of choking, fear of dying, fear of losing control or going crazy, and feeling dizzy, unsteady, lightheaded, or even faint. So now we see that there are some symptoms that might resemble the ones in GAD, but there are some different ones. But what you should know, and if you must focus on one thing, is that the worry in GAD surrounds usually life circumstances and anything related to your everyday life, family, work, health, so all the issues that surround you. Unlike in panic disorder, because in panic disorder, the worry occurs spontaneously and it focuses on when the next panic attack is going to happen. So the person who has a panic attack will think about the next panic attack and when it is going to happen and how he will react to it. So it's a specific concern about a specific topic, unlike GAD, where it is very broad and can be associated to anything really. So this is the main differential diagnosis, and it's important to make a difference because the treatment is different and the way of coping with it is different. So this is the main one. Okay, so now some tips to manage anxiety and stress. Because as we saw, AG is a frequent disorder, but not everyone is affected. So it affects 3% of the population, but every one of us feels anxious and goes through a stress period from time to time. So we can give here are some tips to manage the stress. First, take a time out. It's important to stop what you're doing, to stop the environment you're in and that stresses you, and take some time out to focus on what's important to you and what's going on. So you can do yoga, you can meditate, you can do anything really that makes you happy, and try to focus on this. Eat well balanced meals. It's important not to skip any meal, and always keep a healthy energetic snack next to you at all times. Limit alcohol and caffeine. Yes, that's very important because, as we said, it might trigger some anxiety symptoms, but we shouldn't stop them abruptly because it can cause also some anxiety disorder. Get enough sleep because when you're stressed, your body needs more sleep and more relaxation. And so it's important to take a good night's sleep and rest as much as possible. Exercise daily to help maintain a healthy lifestyle, and it boosts your energy. Take deep breath. So there are many techniques in yoga and Pilates about how your way of breathing can change your emotions, and one of them is just to stop, take a break, and just focus on your breath and take deep breath. Okay, count to 10 slowly is also an option. Do your best and accept that you can't be perfect. So every one of us aims to be perfect, but this is really impossible. You have to stop, you have to assess what you did, and you have to be proud of what you've become and how much you achieved along the way. Accept that you cannot control everything, so some things depend on other people, so you can't really do anything about it, and you must accept that. Welcome humor, it's very important, and it's a way of coping with stress. Maintain a positive attitude and do your best to eliminate any negativity. Get involved in voluntary act, and it will help you create a really good environment and a positive attitude and positive surrounding. Learn what triggers your anxiety. You have to try to learn and understand what makes you anxious and stressed, because this way you will better cope with it and better uh, deal and try to get out of it and talk to someone. So that's very important. It's okay to ask for help. It's very important to do so, whether a friend, a family member, a psychologist, anyway, anything, you name it. You just have to talk to people and tell them how they can help you. So here were some tips to manage your stress, and now we're gonna end with some myths and misconceptions. So you've been you had all the information needed to understand what is GAD and how you can manage it, but it's important to make the difference between some little points. So okay, here are some points. Okay, so when you snap a rubber band on your wrist every time you have a bad thought, it's this is like a supernatural thought or something like that, and anything related to these stuff is based on ancient um, ancient stories and stuff, and it's completely wrong. And studies shows that suppressing your thought makes them stronger and more frequent. This is so think of it this way: the thoughts you resist persist. So the first rule of managing GAD, stress, anything, is not to it's not to avoid these thoughts, because they will come back anyway. If a panic attack gets too bad, you can pass out or lose control. This is completely wrong, because as we said in the symptoms, it's unlikely to faint, which is caused by a sudden drop in blood pressure. During a panic attack, as we said, you have tachycardia and your blood pressure slightly rises. If you have an anxiety disorder, it's important to avoid stress and situations that make you feel stressed, as it's a myth. So treating yourself as if you are fragile and you can't deal with a certain situation is completely wrong, because it will make you weak, and you can be anxious and still do what you have to do. So you shouldn't avoid stress and anything. So the causes of anxiety disorder are usually rooted in childhood, so effective therapy must focus on that period time. So it may be a cause of generalized anxiety disorder. However, research shows that effective treatment focuses on the here and now, including new skills to manage thoughts, emotion, discomfort, and behaviors. We shouldn't focus on the past, we should focus on the present and the future. Medications for anxiety are addictive, so they should be taken only if necessary. No, this is wrong, because SSRIs and are not addictive, and this is the first line treatment. And benzodiazepines might be helpful in the short term, but they can lead to increased tolerance and dependence after long-term use, but we don't use them usually on the first level. Medication is the only treatment for anxiety disorder. Again, this is wrong, because we saw that cognitive behavioral therapy might be very effective, and as effective as medication, if not more. Some people are just bored or neurotic, and there is nothing that can really make a difference. No, because therapy can help you reduce worry and suffering and learn a different relationship to your own thoughts, regardless of your temperament and how long you've been in the situation. So it's not if someone has been living with GAD for 10 years, he can't be the treatment can be as effective as if someone has been stressed for a year. If you eat right, exercise, avoid caffeine, and live a healthy lifestyle, your anxiety will go away. Some of it is true, but it won't be cured. Anxiety are certainly disorders are certainly sensitive to stress, but but it's not stress that causes them. And you need more help than just reducing your stress. We saw that there are many causes. It's not just like a stressful event. So you may need to face your fears, learn new facts about your symptoms, stop avoiding, learn tolerance for some experiences, or change how you think, feel, and behave with respect to other people. A never-ending supply of compassionate reassurance from family and friends and assistance in avoiding stress are good for someone with anxiety problem. So it's good to have some positivity around you, but they shouldn't you shouldn't get caught up in reassurance compulsions because it will keep you away from facing your fears. And we said that you shouldn't avoid fear because it might come back at any time. So, to conclude, some take home messages. GAD is a persistent and excessive worry about everything in your day to day life, whether it's money, health, family, or work. The causes are unknown, but there are biological factors, family background, genetics, life experiences, brain connections that are in action here. The symptoms vary from an irritable feeling to gastrointestinal problems, and finally, the treatment is based on medication and cognitive behavioral treatment. So this is it. Thank you very much. And if you have any question, feel free to ask them.